It's going to be looking at patients really of all ages, but those that have a specific subtype of renal cell carcinoma, what's called translocation type RCC. That's the most common type of RCC in the younger patients, these that we mentioned today. And this will be the first clinical trial that will capture this population. And so what we're going to be looking at is those patients that have, unfortunately, metastatic and unresectable disease. And we're going to be looking at a couple of agents, Pembrolizumab and Axitinib, either in single agents or in a combination. And so it'll be a 3-arm study, a phase 2 trial of that's going to be run by the Children's Oncology Group, but will be available to all institutions through the NCI's National Clinical Trials Network. And so we're excited to roll that out hopefully in the coming months. The use of any agents in this patient population has never been studied in a real clinical trial fashion. So any clinical signal we can find is going to be exciting because we don't know how to treat these patients best. We have insights from maybe some molecular pathophysiology and different agents that have mechanistic rationale, but we don't have clinical evidence to correspond to those. And so we're just really looking for anything at this point. We'd like to see that something works. I think that the overall excitement that people have right now for the checkpoint inhibition in all of oncology, but more recently with the renal cell carcinoma, we hope we could find that there. We'd also be excited to find something with the more, traditional multiple tyrosine kinase inhibitors. So anything we find would be great. But I think maybe the biggest contribution is just going to be further even describing this disease state. So, we'll shoot for the stars and hope to hit the moon.